Hey OT dudes and dudettes! In this video, you'll be learning about dangling in bed for acute care and acute rehab. It is a funny term for sitting on edge of bed, but many occupational, physical, and other therapists use it quite often. Learn why it is done, when it is done, and other tips. Hi, my name is Jeff, and I am an occupational therapist. I make occupational therapy content for students and new grads on my blog, social media, podcast, and here on YouTube. Be sure to subscribe to my channel so that you don't miss a video. Let's get functional. Dangling in bed means to sit on the edge of bed with or without help of the OT. The term probably came from the patient's lower extremities dangling on the edge of the bed. According to the NIH, dangling is an intermediary stage of assisting people into the sitting position with their legs hanging over the side of bed before moving them into standing position, and is therefore used to ensure that patients are moved safely. This can help to prevent notable reductions in blood pressure, i.e. orthostatic hypotension. Dangling is not only limited to patients with cardiac conditions. It can be used in patients who have deconditioned, for patients with poor balance, such as a new onset of stroke, someone who is generally feeling unwell, such as having nausea, someone who has been in bed for several days, or even an ortho patient, such as one with non-weight-bearing precautions for the lower extremities. If OTs suspect orthostatic hypotension, they would take several blood pressure readings starting from laying down, such as in supine. When OTs plan to dangle their patients on the edge of bed, they typically will need to offer physical assistance into sitting. This is done in the usual ways, such as helping at the upper torso and lower extremities. OTs may co-treat with PT to safely assist the patient from supine to sitting, such as in the ICU in acute care or in the ARU too. If patients are really weak or have poor sitting balance, they may need to use both of their upper extremities to support themselves while sitting on the edge of the bed to dangle. The OT then eases off and offers less support in sitting for the patient gradually until they can have both of their hands off of the patient. The OT may need to block the patient in the front or the back to prevent them from falling towards their weaker side. If there is a concern for orthostatic hypotension, the OT would immediately take another blood pressure to compare to prior readings. One goal besides offering less physical support gradually can be also to increase sitting tolerance while dangling with increased time. Or the patient may complete seated edge of bed ADLs such as grooming or dressing if safe. Dangling is considered more difficult than having both of the patient's feet on the ground because there is less support and the patient is forced to use their core muscles more. If a patient is unable to tolerate dangling, the OT would then assist the patient back into laying down position and then giving them a rest break or coming back later. Here are some tips for dangling. Collaborate with nursing, PT, speech for communication, recent symptoms, physical assistance as needed before mobilizing, and things like that. Try to time medications for pain and other symptoms. Some patients may benefit from warm-up stretches or slow, gradual bed inclines with the head of bed in small increments. Take time to prepare the environment, such as removing obstacles, clutter, Foley bags, managing oxygen lines, and having space, plenty of it, for the patient to come into the dangling position. If the patient is smaller or shorter, or the bed does not go very low towards the ground, a step stool may help. Having a chuck pad under the patient before mobilizing may help to slide them towards the edge of bed easier. If you have an electric bed, use your adjustments to your advantage, such as elevating the head of bed or the entire bed up and down itself. You can start with the bed at the lowest position so that the patient can have both feet supported before dangling them. Remember to grab the blood pressure machine beforehand if you suspect orthostatic hypotension. It may also be a good idea to grab a front wheel walker to have nearby if the patient easily progresses from dangling to do a sit to stand and even functional mobility for ADLs, for example. Address the patient's fear of falling, psychosocial factors, use therapeutic breathing, remind the patient to be careful of the precautions, and other needs based on the patient and their goals. I hope this helps. Good luck.